Welcome to Occupational Health and Safety Challenges for the Mobile Workforce, Policy and Practice in Canadian Jurisdictions. We're happy you're here. This webinar is part of our Health and the Mobile Workforce webinar series and is co-presented by On the Move Partnership. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website along with the slides. You will be emailed the direct links for all of these items when they're available. Today's webinar will be co-moderated by Dr. Barb Neese, who is Project Director at the On the Move Partnership at the Memorial University of Newfoundland, and I will let her introduce our presenter, Dr. Catherine Lippel.
Thanks very much, Yusra. So welcome everyone to the third in a series of 3 webinars co-sponsored by WWDPI and the On the Move Partnership. So we've already done 2 webinars with them, an earlier one on workers' compensation in the mobile workforce and one on temporary foreign workers. The On the Move Partnership is a national program of research on extended complex mobility for work in the Canadian context. Now in its 8th year, On the Move has been documenting diverse, complex, extended mobility patterns across multiple sectors and provinces and their consequences for employers, workers and their families, home and host communities, and for policy effectiveness. A key part of On the Move has been a series of studies done under the leadership of Professor Catherine Lippel, Canada Research Chair for Occupational Health and Safety Law at the University of Ottawa. One of these studies has focused on occupational health and safety policy gaps associated with extended complex mobility for work within Canada and into Canada on the part of international migrant workers who come to Canada to work on a temporary basis. Today's webinar focuses on the findings from this health and safety research. As indicated by Yusra, it's entitled Occupational Health and Safety Challenges for the Mobile Workforce, Policy and Practice in Canadian Jurisdictions. Catherine, over to you.
Thanks, Barb, and thanks everybody for being here. So you will see my slides up on the screen. The menu for today, we're going to look at targeted geographical mobile workforce to define who we're talking about in this particular presentation. I'll give you a few words on methods and then talk a little bit about the occupational health and safety frameworks that are applicable in Canada and applicable in our study in particular. We'll then look at the challenges to regulatory effectiveness, which is legal jargon essentially to say, are these laws working for this workforce? What are the things that are working well in terms of occupational health and safety legislation applied to the mobile workforce, and what is less effective? We have a series of conclusions. We're first of all going to talk about links with precarious employment and regulatory effectiveness. There's a concept that you're going to see throughout the presentation where I talk about fuzzy boundaries, where the law is unclear, and when the law is unclear, responsibilities become unclear. There are commonalities between the different sectors of the mobile workforce that we'll be looking at, but also distinctions for certain categories of mobile workers. And right at the end, we'll have a few concluding slides and some policy recommendations. So first of all, the geographically mobile workforce that we're talking about in On the Move overall, and in this presentation in particular, looks at a broad range of people who are moving about for work. On the left-hand side of the screen, you've got people who are moving to, from, and between workstations. So it can be somebody who's commuting between clients on a daily basis. If you think of a home care worker who has 7 or 8 people to visit or 10 houses to visit during the course of the day. It can be somebody who has a short-term commute to get into work, but a short-term commute of several hours. So if you live in Brampton and you have to get into Toronto because you're working for a temp agency who has set you up with different missions in Toronto, you have a short-term commute that takes a significant part of your day and is usually unpaid in those cases, in that example. There are people who are having long-term commutes, long commutes within a province. If you're living in Edmonton and working in Fort McMurray and you're driving up there, you can have a long commute to another province. So you can be living in Newfoundland and commuting to Fort McMurray. Interprovincial mobility is a core piece of what we've been looking at because of issues, as you'll see, that get a little bit more confused when several provinces are involved. We're interested in international commutes, as Barb said, temporary foreign workers, and because there was a specific webinar on that, I'm not going to say too much about temporary foreign workers, although I'd be happy to answer questions in relation to OHS. But we're also in the OHS piece, the Occupational Health and Safety piece, we're also interested in Canadian workers who are working in another country temporarily. People who are flying, say, from any city in Canada to work as engineers in Africa. Those people are also within the purview of our study in the Occupational Health and Safety Policy paper. So everybody on the left-hand side of the screen is commuting or traveling to go and do work. On the right-hand side of the screen, that's also true, but the people we call doubly mobile are people who actually have to travel a fair distance to get to their mobile workplace. So think of people who are traveling from Newfoundland to pick up a ship in Montreal that's going to go down the Great Lakes or that's going to travel internationally. Same thing with hubs for planes, interprovincial trucking, buses, people who have to drive a considerable distance to get the bus that they then have to drive. All of these people are considered in our study to be doubly mobile, and that has specific OHS consequences. I'm not going to talk a lot about mobile workplaces in this presentation. I'm going to talk a little bit about 2 studies, one done by René David Cooper, who did a study on pilots and the question, first of all, the regulatory framework governing the work of pilots, and he did some interviews as well. And Dr. Desai Shan has done a very interesting study on seafarers in the St. Lawrence Seaway, and I'll be drawing from the work of both of these scholars in this presentation. So in terms of methods for my studies, not their studies, but my studies, and this particular study on regulatory effectiveness of occupational health and safety, we're looking at classic legal analysis of the law regulating occupational health and safety in 6 provinces. We're also looking, of course, at the federal jurisdiction for the federally regulated workers as well. So classic legal analysis basically is to make sure that we understand which laws are enforced, what the regulations are, what the case law is, how the case law applies. And often what we do here is to look at cases not just as a source of legal information, to find out who won and who lost, but also to understand the stories that people are bringing to the courts. And that often allows us to identify problems that we wouldn't have anticipated if we just read the law. But we've not only done a legal analysis in these 6 provinces and federally, but we're also looking at key informant interviews that we've undertaken between 2015 and 2018. We have 20 interviews in 5 provinces. There are 47 people in all who were interviewed, including regulators, both for occupational health and safety and workers' compensation, representatives of employers and unions, legal counsel, non-governmental organizations, and over and above that, in some jurisdictions, some regulators preferred to answer only in writing, so they're not counted as in our numbers of key informants, but certainly they have informed this research. We've got quite a lot of correspondence with regulators in different provinces as well. So I'm going to take a pause here and ask you questions. And the first question is the poll question number 1. and it's up on the screen. How are you, if at all, connected to mobile work? Select all that apply. I think the pause has given everybody time to answer this question, and I'll move on from here. And what we have, 100% of participants, so that's a lot of people, advise mobile workers. So that's interesting, and that's helpful for me to frame the types of questions that can be raised. And of course, you can ask questions. We'll look at them at the end, but please feel free to intervene and ask questions that will be looked at by Barb, and then we'll put them together at the end of the presentation. So now we're moving forward to regulatory frameworks. So in occupational health and safety, if everybody on the phone is Canadian and everybody is advising mobile workers, you probably know that Canada is a federation, that there are 13 different provincial and territorial jurisdictions, plus the federal jurisdiction. And so that the portrait of occupational health legislation in Canada is complex. And I'm not going to give you a quick course in constitutional law, but if anybody has questions on who regulates what, I'd be happy to talk about that. Suffice it to say that the federal government regulates about 6% of the workforce, the latest study I've seen in that. However, the workforce that they do regulate includes a lot of mobile workers because they have jurisdiction on transport, interprovincial transport, airlines, trains, planes, interprovincial buses, and of course the railways. So the federal government plays a key role in the regulatory frameworks, but most of the people that we're studying are regulated provincially. And what's in occupational health and safety legislation, I will give you just a quick overview of some of the issues that we're focusing on, because this is usually a 45-hour course in my law school, so you get one slide. First of all, occupational health and safety legislation is designed to prevent injury. So before a worker is injured, the legislation is designed to make sure that actors in the workplace behave in a way that reduces the dangers and hazards in the workplace. And one of our questions will be just to what extent are those hazards applicable when we're talking about the mobile workforce. So the first key obligation is the general duty of employers to provide safe working conditions. And there is a mirror obligation in the legislation in all the provinces we were looking at, where there's a general duty of workers to protect their health. But it's clear that the general duty of employers is far broader than that of workers, in the sense that employers control the working conditions, and the vast majority of obligations in the health and safety legislation fall on the shoulders of workers. Workers have an obligation to comply with the law, of course, and to make sure that their behavior is not creating hazards for other workers or other people, but the employers bear the brunt of the obligations in health and safety in terms of preventing injury and preventing disease. So from a legal perspective, one of the first issues that comes up when you think about the mobile workforce is when we're looking at commuting conditions, are these part of the working conditions that fall within the obligations of the employers in relation to the general duty clause? And much of what I'll be presenting is going to be discussing various aspects of that question. Just to what extent, when we talk about working conditions in occupational health and safety legislation, are we including the conditions that allow these mobile workers to operate? Same thing with the housing conditions for workers who are housed, be they temporary foreign workers in housing provided by employers, or be they fly-in, fly-out workers in Alberta who are staying in work camps. To what extent are those housing conditions regulated, and what are they regulated under? Is it the occupational health and safety law that applies, or is it something else? A key issue in all Canadian jurisdictions is that our systems are based on what we call the internal responsibility system, where the workplace parties, the employers and the workers, the managers and the unions, are supposed to collectively manage the hazards internally. That's a primary discourse, I guess, underpinning our occupational health and safety legislation. Research nationally and internationally informs us that for that to work, workers have to feel comfortable to speak out. And we talk about workers' voice. Workers' voice, can workers speak out about health and safety issues? So the mobile workforce, it's a core part of our report and something I'll be addressing and that is important to pay attention to. And we're going to also talk about the right to refuse dangerous work. We know that in all health and safety legislation in Canada, a worker is, in some provinces, actually obliged to speak out. In other provinces, has the right to speak out and to refuse to undertake a task that they have reasonable grounds to believe is dangerous. So when we talked about the right to refuse in our jargon, the right to refuse dangerous work, that's what we're referring to. And the question is, how does that right work for the mobile workforce, and are there issues that come up in the context of mobility? So those are some of the key issues that we want to be looking at. And I'm now going to start giving you a few results in terms of the things that we have been finding. So we, first of all, have overarching challenges. And these are challenges that affect several categories of the mobile workforce. One of them, which is really important and is by its very nature ignored, is their invisibility. So if you're traveling from Halifax or from regional Newfoundland and going to Alberta, and you get in your car and you're driving to Alberta to undertake work in Alberta, the regulators in Alberta don't really think about you, and the employer in many cases might not be thinking about you. A lot of these mobile workers don't have an employer when they're undertaking this travel. Some people are very well organized, they're unionized, they fly in, they fly out. There are provisions in the collective agreements to govern the travel related to their work, but a lot of people are driving to and from jobs, and at the time that they're doing the commute, they're not necessarily employed. So that we don't think about them from policy perspectives. We don't count them if they get hurt on that commute, and they're quite invisible to regulators, invisible to workplaces, and invisible to a lot of the health and safety professionals. There are also questions about cultural isolation. The obvious example of cultural isolation is, of course, temporary foreign workers who perhaps don't speak the language, who have, there's a lot of work that's been done in particular on agricultural workers who are often coming from countries where the first language is not English or French, and who are living on remote work sites in farms, for instance. Do they have contact with the community? Are they integrated? Do they have a community? Those issues affect psychosocial hazards in the workplace, but also more broadly issues that are important to the workforce who are set apart from the community and can be stigmatized and in some cases discriminated against. That can also be true of workers who are coming from one part of the country and going to work in another part of the country. If the perception of the local community is that they're being invaded by temporary workers who come in for a construction site, for instance, that can create tensions within the community as well. And that's part of, in our report, it's part of health and safety in the sense it's part of the conditions that they are exposed to because of their work. There are vulnerabilities that are specific to each category of the geographically mobile workforce, and within categories there can be differences. So one thing that is very well documented, very well known, but not very well regulated for the moment is the question of deportability of temporary foreign workers. And this has been documented particularly for farm workers, but it's also true of domestic workers, and people in On the Move have done studies on both categories of workers. And we've also done studies on temporary foreign workers who are either in the high skill or low skill streams of temporary foreign work. And in all those cases, regardless of the stream you're in, if people feel that they will not be invited back next year, or if they feel that they're going to lose their ability to stay in Canada if they speak up about something, they're not going to say anything. And in other studies I've done that are related to this one, we've done interviews with labor inspectors in a study led by Ellen McEachen, and one of the labor inspectors we interviewed really said, I've been in places where as much as the temporary foreign workers who were at the work site speak English, it was really clear that they didn't want me to come over and talk to them because they just didn't want to have to go home because of me. So deportability is a huge issue for foreign workers, people who do not have status in Canada beyond their temporary work permit. And it's particularly bad if the work permit is tied to a specific employer. Other mobile workers don't want to get sent home either, but it's much, what's at stake is, no worker in Canada usually wants to lose their job because they speak up, and this is true in health and safety. You don't have to be mobile to not want to lose your job. But temporary foreign workers, it's particularly difficult for them. The other distinction that I want to draw to your attention is something that in the literature, people talk about gold-collar mobile workers who can be distinguished from white-collar or blue-collar mobile workers. Well, gold-collar mobile workers, the engineer who goes to supervise a work site in a dam in Africa is a gold-collar mobile worker. Academics who fly around to come to meetings, we are very much gold-collar mobile workers as well. They're people who have high control of their working conditions and usually fairly good working conditions as well. Blue-collar mobile workers can have good working conditions or not. I mean, the ones who are unionized have better working conditions. But what we found in the results of some of our studies is that the way the law and the policies treat these people, even for similar types of problems, is kind of different, because we tend to treat business travel differently from the way we treat travel for ordinary jobs. And I'll get back to them in a minute. But in other words, another way of saying this is that class does come into the conversation. Hockey players are mobile workers as well, but they're not in the same situation as people who are going to work in the oil sands. And in our report, because there is a report that was produced in relation to this, we divide up our material in 4 stages. We look at the issues that arise while workers are getting to work, issues that arise at work for the mobile workforce, those that arise when you're living at work, be it in a work camp or in a hotel, depending on your situation, and finally, living at home, the issues of work-family balance. And today I'm not going to get into the questions of work-family balance, but I'm happy to entertain questions if people want to raise that through the software. So if we start with getting to work, if everybody online is Canadian, you probably know that weather does not always make traveling easy in Canada. This is a slide that, ironically, I used this in a first presentation that was given in Europe. And this is actually pretty good driving conditions. This was taken by me in Ottawa after they plowed the road. So this is not really, for Canadians, an example of bad driving conditions, but in Europe, they get the message when you look at this. But many of the mobile workforce have to, if you think of home care workers who are in Newfoundland, Kathy Fitzpatrick's work, who are driving between clients who are really very much in need of their services, and where the weather is so bad that they don't feel safe using their cars or taking the buses, and the buses aren't running, or they're not running according to schedule and they have to wait for hours to go from one client to the next. Weather raises serious health issues and serious threats to the safety of the workers. And it's safe to say that for everybody who goes to work, and this can be an issue sometime during the year, but when you're talking about mobile workers who have to get somewhere, and often have to get somewhere where there's no public transport, and they have to get somewhere or they're going to miss a 2-week rotation, we're starting to get into lots of risk-taking behavior that's been documented in the research and On the Move, because people have to get to those patients, or same thing with nurses in Nova Scotia. There's a study coming out of On the Move on home care nurses and the risks they take to get to their patients, but it's also true for people who have to get to that plane so that they can fly to Alberta to do their rotating shift. So if we're talking about getting to work, the types of checklists you have to think about, the real question is who is assuming the risk of the shifting status? And the shifting status I talk about, so I'm on my next slide, and Barb doesn't seem to be. So,
Are the slides changing?
Normally, everybody should be seeing a slide that says.
Yeah, I can see the get into work and from work, correct.
Okay, good. All right, good. So I'll start again on this one. So there's an overarching question on this one, and the question is who assumes the risk of shifting status? So is the shifting status I'm referring to here, the question is, when you're traveling to get to work, is that the worker's responsibility, the worker who takes the risk, or is it the employer's responsibility to prevent hazardous travel? And the short answer to this very long question, I think we've probably got about 50 pages on the big report on this, is that it really depends on the circumstances. Sometimes it's the employer's responsibility, sometimes it's the worker's responsibility, sometimes it's the police's responsibility in certain circumstances. But the question as to who is responsible for figuring out the hazards getting to work and whether those hazards should be undertaken is a very nebulous situation, the answer to that question. So first of all, what are we talking about? So if we talk about road travel, there's a question of vehicle safety, there's a question of driver safety, there's a question of road conditions and road safety. And to give you an idea, there's been some horrendous accidents involving either temporary foreign workers or workers who are working for a temp agency and are picked up in a collective bus. And there's quite a lot of litigation. There are a lot of people who have died in those situations. And the question is this something that's related to work? Is this the employer's responsibility? Is it covered under workers' compensation? Or is this something that is the responsibility of whoever happens to be driving that bus? And there's a lot of, nebulous answers to those questions. Depends on who owns the vehicle. It depends on who told the driver to drive. The road conditions, normally the road conditions are not the responsibility of the employer, but if the employer owns the road, they become the responsibility of the employer in some provinces. You mustn't forget there are other means of transportation. So most of the time, the road issues, most of the cases, this is a public issue and it is not related to the responsibilities of the employer, although there are exceptions. But with other means of transportation, if the employer, there was a horrendous accident in Newfoundland where several workers lost their lives in a helicopter accident. That travel was arranged by the employer and clearly was the responsibility of the company that furnished the helicopter and the employer who was organizing the travel for those workers. Lots of temporary foreign workers are isolated and are given bicycles to go in to do their grocery shopping, and they drive these bicycles on highways. The responsibility for these issues are what we're addressing. What the answers are really vary depending on the province and depending on the issues. But the legal questions you have on the right-hand side of the screen, if conditions of travel are dangerous, does the worker have the right to refuse to undertake that travel? And what we found is that workers have a lot of incentive to take that risk. And we'll come back to this during the course of the presentation, but if you're going to miss the 2-week rotation because you can't get to the airport in time, you're going to drive in really bad conditions to get that plane because you can't afford to miss 2 weeks' work. And if you're unionized, you're not going to get fired because you missed your rotation, but if you're not unionized, you might not have protection of your job if you don't show up at work. And so workers have a lot of incentive to take those risks. And psychological incentives as well. If you think of nurses who are visiting patients, this came out in many of our studies, how important it was to be able to ensure that your patients were okay, because sometimes the nurses are getting these patients out of bed in the morning, and if they can't get to them, they can't get out of bed. So there's a lot of pressure on workers to take risks and to undertake risky travel. And here I have a few slides that come out of an interview that I did with a union rep. I won't say in which province, and we were talking about drive-in, drive-out for mine workers. And the person I was interviewing said, well, fatigue is a giant issue. It's incredible how fatigue is a massive issue, especially in any of the resource extraction industries. Quite often, you know, with the serious fatalities and serious incidents, when we take a look at the investigations, fatigue is always a factor. And I ask, well, what part of that fatigue is attributable to commuting, if any? And he says, well, I mean, that's contingent upon the job, right? A lot of people always be sleeping on the buses. You know, when I was talking about the name of a town that was maybe 2 hours drive outside of a mine destination, everybody sleeps on that bus. That's good sleep time, right? It's 2 hours, but he says that's good sleep time. And most people will try and sleep on the commute, as long as they're not the one who has to drive or something, but that's not always possible, right? And then he goes on, I ask him questions about the shifts in relation to these same workers, and it's 3.5 days. So 3 days in and 3 days out. But they'll get in a car and drive overnight into that community we mentioned in the previous slide. They'll get on the bus, and then the company does the rest of the driving all the way up to the mine. So I say, okay, so they'll get in the car and they drive overnight, yeah, on their own dime. So if they're injured in that drive, they're not covered. And that means workers' compensation if they're injured while they're driving from Edmonton up to, this is not in Alberta, but were it to be up to Fort McMurray, they're not covered. It's not a work accident if they have an accident on the highway. And then the company picks them up at the community, that same community, yeah, and they get on a bus. And then my question is, do they start right away? And he said, oh yeah, you get off the bus and you're pretty much on shift, right? You drop your stuff and there you go. So these are 12-hour shifts in highly skilled, highly dangerous working conditions. The people have perhaps been driving all night. So that, just remember that, and when we get to recommendations, I'm going to send in a question out to the people participating to think about this as well. Factors that are contributing to pilot fatigue. This is one study by René David Cooper, and he has already published on the regulations governing these people. But his take-home message, he did some interviews, and there's multiple jurisdictions in Canada that regulate flying time and duty time, and compliance is variable. He found that the laws were not always well applied, and that they will be well applied. It really depends on the type of the aircraft and the size. So clearly, if it's a big commercial airline, passenger safety is priority. The laws are very well applied in those circumstances. But if you're a bush pilot, you're not that visible, first of all, to regulators because you're literally in the bush. And secondly, these are small operations, and he found that the effectiveness of the legislation was less good in those small operations. But what he found also, which I think is particularly important for policymakers, but for all of us to think about, and Desai Shan in her study found something very similar, is that there's an incentive for the least experienced pilots to accept back-to-back shifts to gain seniority. So the pilots who are the least likely to know what to do in an emergency, they're all supposed to know, but the ones who know the less are the ones who only recently started, they are more likely to do back-to-back shifts, and therefore fatigue, the way that the regulations apply, if they're not being well applied, the people who are most likely to be doing longer hours than they're supposed to be are the young and experienced pilots. And this came out of the Shan study as well for the seafarers, because if you need seniority, you accept, if you're offered to do an extra shift, you accept it more easily. So that's something we need to be thinking about for the young workers in these mobile workplaces. Where it's safety sensitive, how is this applying to them, and how well are we making sure that the legislation is applied? A few words on work camps, and I'm not going to spend a long time on this. Workers' compensation, we talked about this already if you attended that. But the question is, and this has an OHS repercussion if a worker is injured in a work camp for somebody who is living in a work camp in Fort McMurray, or in a hotel for your business traveler who has to stay in a hotel because they have to travel for work. Is that a compensable injury? And our answer in workers' comp was that it was pretty fuzzy, I couldn't, as a lawyer, guess what the outcome of a given case would be in many of these provinces. The other aspect that we found out was that there's very little regulation, occupational health and safety regulation on work camps. So that in some provinces there's none, in some they're using the Environmental Protection Act to intervene in work camps. A few have health and safety regulations, but very many don't. And the case that was quite famous in Alberta, made the press, was in a fast food restaurant where all the temporary foreign workers were sleeping in the fast food restaurant. The food, the quality of the people who are managing the quality of food that is given to public consumers were the ones who had to intervene, because there's nothing to protect those workers from a health and safety perspective from sleeping in their fast food restaurant. So just to illustrate what I mean by fuzzy boundaries, this is just one example that comes from Quebec. We have a case where an engineer travels from Quebec to go to France to consult on a construction project, and during his stay, in his off time, really, he goes to visit an ancient ruin and he falls down and he's very seriously injured. And the appeal tribunal held that that was a work-related injury because he wouldn't be wandering around the ruins of France were it not for the fact that he was in France because of his work. There's a decision on a similar kind of gold collar mobility that says the contrary, that says no, when the worker is going out to eat or doing leisure activities on the weekend, that is not work-related. But many of the cases, and I would say the majority of the cases in the majority of the provinces, when you're talking about business travel, if you fall down in your hotel room shower and you hurt yourself, that will be a compensable injury. Whereas if you look at the policy in relation to blue-collar workers who are staying even in a hotel paid for by the employer, there are many cases where, in Alberta, for instance, the policy will say that will depend on the nature of the hazards in the hotel room. So there's not consistent application of these principles, and we have different principles for business travel than we do for the other workers. Second poll question, do you have experience with occupational health and safety related to mobile work? Okay, so that's binary, so I think everybody will have had time to answer that, and I'll click on my screen here and move forward. Now, I'm winding down into the results, and then I'm going to get into the synthesis. So these are some of the, we're starting getting into recommendations that come out of our study. The issue of health and safety committees. One of the things we found from a variety of sources was health and safety inspectorates and health and safety committees need to adapt their practices when workers are engaged in employment-related geographic mobility. Because we have to think about those workers differently than if the workers live in the community in which they're working. If you're thinking of health and safety committees, some of the focus groups we did, people were saying if you're doing fly-in, fly-out, you're gone when there might be a meeting in the health and safety committee. So that it's very difficult to recruit workers who want to be on these health and safety committees because they're not going to be around and aren't going to commit to being available if they have to fly out immediately at the end of shift. One innovative strategy that I'll just throw out there came out of a related study that I was doing with David Walters, looking at the health and safety committees. It comes out of a province in which there is drive-in, drive-out going up to a mine. And what the health and safety, the union rep in charge of health and safety, he and the union president said they were really having a hard time mobilizing people. And people on the bus, they would get in and they were always on their phones. And all of a sudden they said, well, why don't we exploit that? And so they started doing a blog where when the workers got on the bus, and it's not the same bus or the same province as the previous quote, There was a text message that goes out to everybody on the bus saying, these are the near misses on the previous shift, or these are the things that did happen, or these are the things that you have to watch out for. And it turned out that this became an excellent vehicle for mobilizing workers who became really interested in their health and safety because that's what they were doing on the bus. To the point where even the supervisor every now and then asks the union if they can use that vehicle, if they will pass a message that the supervisor wants to use. So it becomes an excellent organizing and communication strategy. So exploit the mobility to think in new ways, think outside the box. That's what this slide is suggesting you might want to do. And the next slide, in terms of regulatory effectiveness, and here I'm starting into the different conclusions. So a lot of, I don't know who's on the phone, but a lot of the literature and a lot of the work I've done has looked at precarious employment. People who are working for temp agencies, people who are in short-term contracts, subcontracting, etc. And we know from that literature that those people are largely invisible to regulators and to traditional OHS unions, actors like unions. And what we found in this study on the mobile workforce is that there's an overlap, not necessarily because mobile workers are precarious, they're not necessarily precarious, but a lot of the invisibility of the mobile workforce is similar to the invisibility of the precariously employed workers. And it's really about the visibility. Temporary foreign workers are overly visible on some issues, and then that gets into discrimination and exclusion and social exclusion. But they're under-visible or less visible. We did interviews in some provinces where people in charge of representing injured workers didn't know that there were any temporary foreign workers in those provinces. So the regulators provincially don't know where the temporary foreign workers are in many cases. And that leads to questions like, if you can't count them, do they count? So if you're tracking exposures to asbestos for somebody who is doing work in 6 provinces, how are you going to track that? The statistical data, if people are injured in Alberta and claiming in Nova Scotia, how does that work in terms of priorities for prevention? If they're not claiming at all because they don't have voice and they're afraid to claim, again, they disappear, and that makes them invisible to those who set priorities. If injuries are sustained in non-compensable activities like traveling to or from work or living in temporary housing, that's a cost of this work organization that is invisible to those evaluating the hazards of work, the hazards of work that is organized in a way that requires mobility. And of course, for those who are interested in fatigue and the safety-sensitive industries in particular, travel can really neutralize prevention strategies. In terms of my conclusions, commonalities, all the different geographically mobile workers, in terms of getting to work, living at work, and living at home, they had similar issues, and the key word in that is we're shifting risks to workers. The workers are taking a chance, they're taking their car when they shouldn't, just because they need to get to work, and that is the worker and his family or her family who pays the price if they're injured during that. And of course, welfare and the social security system, other than workers' compensation, if they're seriously injured and become disabled. Commonalities in terms of exposure to hazards at work, it really depends on the work. I would just here point specifically to the fatigue and safety sensitive jobs, which is cross-cutting everywhere. And this came out of studies on seafarers, pilots, construction, mining, and home care. Getting to work that leads to fatigue contributes to the hazards when those workers are doing their work. In terms of fuzzy boundaries, fuzzy responsibilities, if you don't know as an employer that you're responsible for the travel, if you are responsible, then you're perhaps not going to manage the travel. And so that's something that needs to be discussed. In terms of jurisdictions, when you've got multiple jurisdictions, you really, for instance, when there's a road accident for an interprovincial truck, There are 5 different jurisdictions who have to go. The health and safety provincial people go to see if it's a provincial truck or a federal truck. Theoretically, the federal people go. Then it's the police who have to go if it's a car accident, but if it's the brakes that fail, then that's perhaps a different issue. So we're spending a lot of energy on fuzzy jurisdictions in this field. There are economic incentives for employer prevention measures for travel-related hazards that do not exist because experience rating in many of these jurisdictions under workers' compensation is the key incentive to prevention. And particularly in Quebec, where I come from, maximum $60,000 fine if you violate the Health and Safety Act. But if the costs of an accident end up in your file, then that's going to cost a lot of money. If it's not compensable, then that's completely invisible as an incentive for employers. There are economic and moral incentives for risk-taking by workers that are significant. So we have an imbalance here that I think collectively we need to be thinking about. Remote workplaces, a lot of these workers are working remotely. It contributes to exposures to hazards, as we know, if you're working alone with volatile substances, for instance. And it compromises regulatory effectiveness because there are not inspectors everywhere, and the more remotely you're working, the less likely you're going to be able to access an inspector if you need to be doing that. Finally, in terms of policy recommendations, we have a series of recommendations in our policy report. And in terms of targets, we talk about provincial and federal regulators, employers, and unions. And we look at jurisdictional issues, right to refuse. I didn't talk about that today, but just to give you an idea, if you're being sent to a country that is at war, and this is a case that came out of Quebec, an engineer who was told that he should show up in somewhere where there was a civil war, and he didn't want to go because it was dangerous. The jurisdiction, according to the case law, provinces do not have jurisdiction to apply the right to refuse for activities out of province. And that has come up in several jurisdictions, and that's a problem. Nobody has jurisdiction to prevent that interprovincial travel, except the federal jurisdiction, who doesn't have jurisdiction because it's not one of their workers. Worker voice, I think we've talked about that quite a lot. The regulatory gaps in terms of housing, we've also addressed. And addressing fatigue and travel-related hazards, and this is where I'm going to lead into a discussion. So remember this bit, and I hope somebody has some ideas on this. The fatigue and travel-related hazards have been well addressed by the federal regulator on many different aspects. And in terms of our own recommendations, this is what today or later on I'd like to hear from you about, how much do we want employers to be responsible for managing organizational risks related to fatigue? One option would be to say, well, they are responsible and therefore they should be paying for a night of sleep before the work starts the next day. But on the other hand, how much do we want workers' privacy to be controlled by the employers? Because of course, if they're controlling that, they're going to want to be controlling more of workers' choices in terms of their travel. So I'm concluding by thanking On the Move and our sponsors who are up on this slide, and I'm turning it over to Barb, who will tell me all about all your questions.
Thanks very much, Catherine.
So the first one is, hi, I am a PhD student looking at the embodiment of transience, long-term relational and health impacts of repeated systemic displacement and stressful travel, working with musicians on tour. So under the getting to work, living at work on the road, and work-family balance areas, anything you could recommend to read on more self-employed, highly mobile workers?
Thanks for that question. I'm quite interested in the self-employed right now. It's not in the On the Move project, it's in a new project that we're looking at for return to work. And we're studying, we've just started, but we're studying return to work for the self-employed as well, and how that works. And what we're finding, first of all, from a case law perspective, it's not a very rich source of information because in terms of workers' compensation in most provinces, the self-employed aren't covered. so that I'm a legal scholar, so that's my primary source. In terms of regulation, the regulatory protections for the self-employed vary between provinces and vary between the circumstances for the self-employed as well. I mean, certainly the work-family balance literature is a place that I would look at. I don't know why you have an
because
answer?
when we did Karen Hughes and Will Silver did a review of the literature on work-family balance through the lens of mobility, and they found virtually nothing in that literature on mobility. So that their review was just published a month ago, I think, in Human Resources, I think. It's an Australian journal. So there's not a lot out there, and there is a literature on musicians. They're not a group that we focused on in this study, but there is a small literature, I think, but I'm not sure how much it focuses on the mobility issues.
There's a professor in Alberta who works on return to work and musicians, who, by the end of the webinar, I'll remember her name, and this will come back to me.
So we've got a couple of other questions.
Okay.
Can you give examples of policies or strategies to be implemented to adapt to mobile workers and weather conditions?
Okay, so first of all, I just remembered the professor's name. Her name is Christine Guptill, the woman who's working on the working conditions of musicians. And in terms of policies or strategies to be implemented to adapt to mobile workers and weather conditions, it sort of depends on the category of mobility. So the policies that I would suggest in relation to home care workers would be different than if I was looking at workers who are traveling interprovincially to work in the extractive industries. So if I start with workers who are traveling interprovincially working for extractive industries, one of the things that we've been discussing in our report is the possibility of requiring that sleep time be either negotiated. Certainly before we were talking about regulating, if I was giving advice to unions and employers, I would say it would be important if you're negotiating shifts that sleep be paid for as part of that shift, and that it start the shift, and the same thing when the person is leaving, that they're paid to sleep for 6 or 7 or 8 hours before they leave. Now, clearly, if you're talking about Tim Hortons, this is a different conversation than if you're talking about a major, work in the oil sands. But certainly, large industry should be able to preemptively pay workers so that they are staying on site for the necessary time to avoid fatalities on the highway. A lot of people leave work at the end of their 12-hour shift. So that's an example.
Yeah, I mean, we've certainly run into this issue in Newfoundland. So we had the Long Harbour construction site. So you had a very large labor force, but very little accommodation on site. So the question is, so if you've traveled out there for work and the commutes were anywhere from an hour to an hour and a half one way, 2 hours, and a blizzard comes in, and there's actually no accommodation in the region where workers could stay. And so the question is, what is the policy framework of that company? How have they planned for this type of incident? Now, part of it is monitoring weather, obviously, and if there's something coming in, making sure that people have a right to leave early, and so on. But I think there are real challenges, and this is a not uncommon situation in the province where I come from, where you have people who are on a living out allowance. So technically, they're not in employer-provided accommodation, and they're compensated for the travel, but you are traveling a long distance, often in very bad weather. And the question is, do I leave home or not? And what happens if I don't? What components are needed to implement, or what further research or steps should be taken to improve policies and practices related to mobile workers? Is there any other policies or practices you think we should emphasize?
Okay, so what components are needed to implement more adequate policies?
From a legal perspective.
Well, I don't know. The way I would answer that is not necessarily from a legal perspective, but I think the first thing is everybody has to look from where they're coming from to say, what do I control that could be better adapted to meeting the health and safety needs of this workforce? So if I'm a union, what kind of language would I like to get? If I'm an employer, how can I organize work in a way that is going to expose them to fewer hazards? For the travel, I think the travel is pretty key. The fatigue and the travel, if there was one issue that people will really need to collectively think about, I think that would be it. There's many issues, but that would be, I think, a key one. What I didn't talk about was work-family balance and access to the internet. If you have people who are working on ships, for instance, for 6 months at a time, at one time, some of the data we got was that the officers had access to the internet, but the ratings, in other words, the ordinary workers on the ships, didn't have internet access. And of course, if you don't have internet access and you're a distance from your family, that is a huge issue, not just for work-family balance, but it's a health and safety issue in relation to worker well-being and their ability to do their work and have peace of mind at the same time and keep their families. So that's something that I hadn't talked about. And what further research should be taken to improve policies and practices related to mobile workers? I mean, that's a broad question. If I'm just looking at OHS, what I would say is that it's not, we've done an awful lot of research. And I think either we need to do research on political will, but if we could skip the research and just get the political will, I think that would be good. So that I think the ball is in the court of policymakers, but policymakers writ large. That doesn't necessarily mean we need a new law. But workplace policy is developed by workplaces, and unions influence policy, and workers who are not unionized can influence policy as well. But workers are the least capable of influencing policy unless they're really highly skilled workers. So I think employers have to think about this. I think business schools have to think about this. Business schools have to start teaching. When they teach health and safety, they have to have at least 3 hours on mobility. I've never seen that in any training that I've seen in health and safety training. So I think the fact that this webinar is taking place is a good thing in the sense that the people who follow these webinars, not our series, but the series more broadly that is run out of BC, are health and safety people. And so do you have a course on mobility, or do you have a conversation on mobility in the training that you're giving? I mean, I'm happy, I'm a researcher, so I can invent questions forever. But I think it's more important that the people in the workplaces start asking the researchers to share plain language stuff to be able to use that more easily within their different modes of intervention. You know, where if they're teaching or if they're giving health and safety training as part of a hiring practice, I think we need more dissemination. But as researchers, and I'm looking at Barb because she's much more experienced than I am on this, I think as researchers we need people to ask us for stuff. And we can provide a 2-page pamphlet, a 10-page pamphlet, a 100-page report. We can write a book, but we need to know that people want this material and that we're open to suggestions on that.
Yeah, and I mean, since this research started, we have better data on interprovincial mobility than we had before, but it's not easily available, and so we need data that makes things like this visible, the so-called shadow populations of migrant workers who are flying and driving around the country really don't show up. I can remember a conversation with someone who had worked at Bull-Arm, with, again, engaging in very long commutes. He said at one point he had sat down with someone else, and, the big focus is on accident-free days on site. But they actually did a calculation of the number of people who died commuting, and it was substantial, right? And they looked not just at their place, but they actually looked globally at that sector. And so there are real consequences, I think, of externalizing that risk. And the point is that it's a blurred responsibility, in the sense that if the employer expects you to be there and the employer is meeting a deadline and trying to get a big job done, from a construction point of view, you can imagine all kinds of pressures to be there, but the worker may well not want to live on site because they want to live at home with their family, even if they're leaving at 4 in the morning in order to get to work and not getting at home until 10 o'clock at night. So I did a rough calculation. I think we're talking about 15% of the Canadian labor force that's engaging in some kind of extended complex mobility for work. That could be a long daily commute where you leave at 5 in the morning and you don't get home till late, or it's interprovincial, you're away for 6 weeks, 8 weeks at a time, or temporary foreign workers could be away for years. The point is that this is a key element of work in the lives of many people, and we're not paying enough attention to it.
Thank you, Barb and Catherine. Catherine, we're grateful for this very informative webinar and your expertise on occupational health and safety challenges for the mobile workforce versus the policy and practice in Canadian jurisdiction. It is important to be aware of some hazards to which members of the mobile workforce are exposed to. Thank you for bringing to our attention that these factors are not necessarily addressed by the current regulatory or working structures in place, and that there is a need to adapt prevention strategies to the reality of workers. And Barb, thank you so much for your valuable contribution to the Health and the Mobile Workforce webinar series, for your time, and for moderating our webinars so efficiently. To our audience, thank you all so much for your interest and participation.